One, check one. 1, 2, check one. It keeps cutting in and out.
What are we doing?
1, 2. Check one. Check 1, 1, 2. 1, 1, 2, 2, 2, 1. No, you gotta be kidding me. Check 1, 1, 2. 2, 1, 2, 1, 2, 2, 2, 2, 2. 1, 2, 1, 2, 2, 2. Is that one? 1, 2, 2, 1, 2. Check 1, 2. Kidding me. What? Something just telling me. Check 1, 1, 2, 1, 2, 1, 2. Check 1, 1, 2, 1, 2.
Check one.
Check, check, check. Check, check, check.
Nice shoes.
They were both working. No, no. But they were both working until you guys shut up, so there's got to be something interfering with the food. Check. Check. The computer. Check 1, 2, 1. Hey. Check. 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 Check, 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 check. Ooh. Check. Check.
Check. Yeah, it's working a lot better now.
Still not coming through.
Yes, sir.
Hey, let me see. Hello, hello, hello. There's no way. It doesn't even work this far away, dude. Hello, hello, hello. What about the girls?
So Jamin, you could do the talk with Ryan.
No, you're doing it.
Me?
Yes.
I mean, why don't you do the?
Yeah, no, you're doing it. We're just testing. I'm fixing this issue. You fix it. The mic does? Yeah. Okay. How do I, can I get inside this car? Can I get inside?
Sorry.
Hey guys, how are you guys doing? We're having AV difficulties here, but no problem, no problem. Oh, what'd you guys do? What'd you guys do? I think we should do it from here then, because right over here it gets screwed up. What do you guys think? I think it's a safer bet. So welcome Lumberton. Let's hear our Lumberton crew. Big crowd here. All right. And in Lumberton here, we have some exciting events, several exciting events, and I'm gonna hand it over. Oh yeah. So we're just waiting for my partner here to finish eating. We're getting, he needs to charge himself as well. Are you charged, supercharged, or lightly charged, or? And you're eating. It looks like pizza, but it's not pizza. It's actually vegetables and fruits made into pizza because we're being healthy for men's health. So at this point in time, I want to introduce my partner back up here, Sijo Pericottl, and then I'm also going to he's going to introduce Dr. Ryan Terlecki. Dr. Terlecki does some amazing research, and some of the funds that we are raising at D4MH.com and on this drive are going to be used for some of his genetic studies. I remember Dr. Terlecki, I first met him at a conference. I was giving a poster presentation, and he was very kind to me, I remember, at the presentation. No, but he is a great guy. He's a visionary, as we are, and he's a huge supporter of men's health. So I'm excited for him being here today. And he may not say this, but he drove 3 hours and he waited for us to come. So thank you, Dr. Terlecki. But I'm going to hand it over to Dr. Pericottl to give the official welcoming.
Thank you so much again for coming over, and really appreciate your patience. And so, Dr. Terlecki's a very humble guy, but really a future rising star in the AUA, and has received numerous NIH grants, and we're honored to try and help him. And part of the drive is to raise funds to help some of his projects, and we're really enthusiastic and looking forward to working with him over the years to come. So,
thank you very much. It's my pleasure to be here. So what a great event. Well, would you like me to go ahead?
Sure, absolutely. You can take a seat, or you want it, we can advance.
All right. We can go back one more just to kind of highlight the title here, because I think it's relevant for what you're trying to accomplish. And so the title of the talk is Drive for Men's Health. The way to a man's heart may truly be through his penis. And so as the director of the Men's Health Clinic, a big part of my job is to deal with sexual health. And a lot of that involves men's erectile function. But over the past few years, certainly there's been a surge in the issue of testosterone deficiency. So if we could go to the next slide. So perhaps...
Jen's there. Jen, you don't mind, right? Yeah.
So being from Detroit, we're big car people, of course. And so my dream ride is, of course, the 68 Fiber convertible. Not as good, but we'll bring it back. But certainly you're just surrounded by gorgeous cars today. So what a better way to kick this off. Right? So we'll go to the next slide. Oh, fantastic. All right. So in men's health, we consider a number of different topics. We think about weight, activity, nutrition, certainly tobacco use, mental health, cardiovascular risk factors, which we'll talk about in more detail today, bone health, cancer screenings, urinary health, and of course sexual health and andrology. And that's really where it falls into our wheelhouse. So, Sigmund Freud described the basic drives of life for animal species, and these involve eating, sleeping, and sex. And so if you knock out one, that's one of the big three.
That's huge.
For sure. So, ED is described as the inability to maintain or achieve an erection for satisfactory sexual intercourse. And what might be satisfactory to one mind might be different from that of another. But certainly it's not uncommon. So for the gentlemen who come into the office, you want to let them know that they're not alone, because it's seen in the majority of men over the age of 40. And the probability increases with age and often associated with other medical conditions and certainly treatment for those conditions. So diagnosis and treatment is important not only for men but also for their partners. So men's health can become couples' health. So looking at longitudinal aging studies, they did demonstrate that over half, therefore the majority of men over the age of 40, did demonstrate some erectile dysfunction. So it's certainly relevant to the majority of the male population. Now, there's a number of contributing factors, so no two patients are the exact same, but certainly within this group, you can see that hypertension, vascular disease, low testosterone, heart disease, smoking, and risk factors you see associated typically with the major killer of men, which is heart disease, overlap significantly. So what I tell my patients, whenever they come in, whether it's for sexual health or urinary health, it's all plumbing and electricity, right? Blood flow, nerve input, and so forth. So go to the next slide. All right. So what's the connection to the heart, right? So both ED and vascular disease share the same risk factors. Endothelial dysfunction is not a term that's used very commonly, but I hope to make people aware of this today. So it's the common underlying reason. So what happens is before those plaques build up on the inside of blood vessels, you start to lose tone. So we talk about hardening of the arteries, really. And you can measure this in a non-invasive way. And Craig Harkey is here from the Heart Health Institute Assessment Group. And he's going to be offering this screening test to a couple gentlemen here at this stop today. So up to 2/3 of men with coronary artery disease will have ED. So since the arteries that do supply an erection are actually smaller than that of the coronary arteries, the same degree of lipid plaque burden has a greater effect, relatively. So as a result, consequences of penile vascular disease, i.e. ED, can manifest 2 to 3 years before a patient shows signs of heart disease. For some men with no heart symptoms, ED may be a sign of an opportunity to intervene and prevent problems. So we're talking about proactive men's health. The second Princeton consensus guidelines state that a man with ED and no cardiac symptoms should be considered a cardiac patient until proven otherwise. So this is just a photo to show you that lipid builds up in the wall, but before you get to that point, you can demonstrate endothelial dysfunction. So if ED is just one example, you can extend that out to the whole body. And potentially, if you identify this early, perhaps with lifestyle modifications, you could prevent downstream ramifications. So EndoPAD is the study that's being performed off to my left. And what it is, it's a rapid, non-invasive test of endothelial dysfunction or loss of tone of those blood vessels. It's been shown to be useful to identify patients at risk for adverse cardiac events down the road. And what it does is it uses a cuff on the upper arm, and it monitors changes in the flow of the fingers, and then a score is generated upon completion. And below a certain score, it suggests that you're at risk for cardiac disease. And some would even imply that it suggests you have underlying vascular disease, but yet it hasn't been characterized. So what about testosterone? You can't turn on the radio, the TV, open a newspaper without seeing some advertisement or some form of direct-to-consumer marketing talking about men with low testosterone. So there's increasing recognition among healthcare providers, but there is a need for better understanding, not only for men that are at risk, but also for the people treating those men. So why should someone care? Well, the most common symptoms that we're seeing men for tend to be sexual, but it has an important role for a number of details within men's health. So, in terms of fact or fiction, does it affect only a man's sex drive and muscle? No, it has a much greater impact on their overall health. So, the body has a tight system to regulate maintenance of testosterone. We talk about signals from the brain to the pituitary gland down to the testicle, and then a feedback loop that suggests to shut off production once you've reached your goals. So this is just kind of a schematic showing that relationship. And the testicles have two main jobs: production of testosterone and production of sperm. So looking at the whole body and thinking about the functions of testosterone in a top-down fashion, in terms of the brain, we talk about sex drive, but the word for that is libido, right? Your basic primal urge to pursue sexual activity. It is not the same thing as erectile function. So in terms of skin, you can think about items such as facial and body hair. When we talk about male pattern baldness, certainly there's a hormonal relationship there. In terms of the bone marrow, some people with low testosterone may be anemic, having low numbers of red blood cells. And so you see some athletes try to abuse testosterone because they know they'll raise red blood cells. But what that means is you carry more oxygen, you have more stamina, more endurance. In terms of bone, there's an association with improved bone mineral density. In terms of the sex organs, we already talked about sperm production, but it can also be related to prostate growth and erectile function. And then, of course, muscle mass and strength. So low testosterone happens when the testicles no longer make adequate amounts. Now, granted, about 10% of a man's testosterone is produced by the adrenal glands. So the medical term for low testosterone, or low T, is hypogonadism. So you may see this on advertisements as well. So if it's a primary problem, it means that the boys downstairs aren't doing their job. If it's a secondary problem, it means it's more upstream. Okay? And it can affect any man regardless of age. Some causes can be certainly damage to the testicles from radiation, chemotherapy, prior infection, having a tumor, injury or disease to the brain or pituitary gland, genetic conditions, and sometimes it's just unknown. Certain men are more likely to have low T, and these include those men with type 2 diabetes, perhaps if they're already presenting with erectile dysfunction, obesity, overweight, COPD, people on medications for chronic pain as narcotics have been shown to drop testosterone levels, and men over the age of 45. So men with type 2 diabetes are especially at risk because at least 1/3 already have low T, and studies have shown that men with low T are significantly more likely to develop diabetes. Overweight men are twice as likely as other men to have low T. So is this a serious condition? Well, there was one large study looking at veterans in 2006 that showed that low testosterone is associated with increased mortality. So that's very important. There is certainly an information gap. In one survey, 91% of men haven't heard of low T, although that's likely changing, again, with all the direct-to-consumer marketing. Up to 13 million men over the age of 45 are affected in this country. But then you ask, why are so few treated? Some people put their symptoms up to just getting older. They say they're only going to the doctor if they're about to die. That's a big problem in men's health. We're not as proactive in terms of pursuing items of preventive health maintenance as women are. You may consider a private issue between only you and your partner. Many doctors are unaware of how to properly screen and treat for items related to low testosterone. So again, it's a clinical syndrome based on a history and physical exam as well as characteristic symptoms, but sometimes these aren't specific. To check testosterone, it simply involves a basic blood test. The sexual symptoms, as we discussed, could be changes in erection or sex drive, change in orgasm, and change in ejaculate volume. In terms of non-sexual symptoms, it can be related to a depressed mood, a decrease in muscle mass and strength. We talk about items such as vitality, energy, motivation, and even short-term memory. In terms of physical signs that you can actually demonstrate, these might be related to a decrease in bone density, hair loss, changes in body composition. So perhaps you may wonder why sometimes in the female variety they put on weight all over, whereas men just have that central obesity up front, and that can be related to a deficiency in testosterone. And as we mentioned, the changes in red blood cell count. So certainly things do change with time. So if you look at Schwarzenegger as a younger man, granted, he admitted to using all kinds of items then, but was listed, and speaking of Guinness Book of World Records, at one point was considered the most perfectly developed human. But certainly now it's a little bit different. So replacement therapy is designed to improve levels back to the normal range, and there's several options, and are usually covered by insurance in the setting of low T, and they have been proven safe and effective in trials. In terms of injections, they're typically given every 2 weeks, and they can have a roller coaster effect. It could be painful. Patches or gels are applied daily. It can cause some skin irritation, and you worry about transference in some cases. So in terms of adverse effects, again, skin irritation, breast tenderness, depending on how you provide the testosterone, you can have infections related to injection or implants that are placed. But one of the big concerns now in terms of the risk of testosterone replacement is if there is a cardiac risk. So 3 studies have come forward trying to address this issue. One was initially in the New England Journal, and then JAMA, and then the Journal Plus One. So certainly we talked about the increase in red blood cells. If it gets too high, you have to back down in testosterone replacement because you worry about a hyperviscosity. You can see swelling in the feet and ankles. A decrease in the testicular volume is normal, and of course infertility. So someone wishing to preserve their fertility should not be on testosterone. So again, going back to the recent studies, these have now been reviewed because these were poorly designed studies. And experts in the field, as well as the FDA and the American Neurological Association, have concluded that there is no conclusive evidence to support any association between testosterone replacement and the risk of stroke or heart attack. The FDA statement has gone a little bit further and says patients should not stop taking prescribed testosterone products without first discussing any questions or concerns with their healthcare professionals. Men who want to father more children certainly should exercise caution, and men with significant urinary obstruction from untreated enlargement of the prostate. And then certainly if you already have swelling related to heart, liver, or kidney disease, you want to speak with your doctor before starting any therapy. So what about prostate cancer? The current evidence does not support that testosterone is related to the development of prostate cancer. However, if a patient has untreated prostate cancer, it's still considered a contraindication, although that may be changing. So again, the benefits are improvements in sex drive, performance and erections, energy, well-being, muscle mass, perhaps bone mineral density, and a reduction in body fat. In recent news, topical testosterone has also been shown to improve the memory of postmenopausal women, and this is likely translates into to men as well. Benefits have been shown in older men with early dementia, and replacement prolonged survival in men with type 2 diabetes. So in conclusion, ED may be related to factors also associated with heart disease, and non-invasive screening is available, as being demonstrated today. Testosterone replacement has been shown to help men live longer and better, and appears to be safe in well-selected patients. And certainly a trained specialist can help individualize treatment. So,
this is great. So really, this whole endopath testing could really change the way we think about approaching these guys, right? I mean, so if a guy walks in with new complaints of erectile dysfunction, doesn't really have any cardiac history, what you're suggesting is maybe the first thing to test is their cardiovascular risk, right? I mean, from a vascular standpoint.
certainly. So we talk about Framingham risk scores and things of that sort. But I think now we have an obligation as being the leaders and experts in men's health as urologists to really screen for those problems, right? Talking to them about smoking, their weight, their diet, and so forth. But, you know, Viagra kind of changed the game. So men that would not go to the doctor before, now that you have a solution to improve their sex life, they're going to come out of the woodwork. And we've already seen that over the past 10 to 15 years. And so now that they're in the office, you have a key opportunity to address their long-term health. If they have ED and you show them the association between future development of heart disease, it's a great time to intervene proactively.
That's great. So in your clinics now, do you routinely offer endopath for testing?
So Craig has been great. We actually set up shared medical appointments, and we've offered endopath as part of those. And so guys have come in, and the exam takes about 10 to 15 minutes. And typically he can run multiple exams at the same time with the assistance of one of our nurses. And it generates a score. So he calculates what's called the endo score, or the index that comes back to us. And if it's below a value of 1.67, that essentially suggests that there's underlying endothelial dysfunction, therefore vascular disease. And so if someone doesn't already have a cardiologist, it may need a referral, may prompt ordering something similar to an EKG or another panel of tests. But certainly lifestyle modifications are going to be important in that population of patients.
Well, again, Dr. Chalky, thank you so much for coming out and presenting this awesome work. You know, it really is, I think it's going to revolutionize the way we think about these patients, kind of, you know, because we always kind of think about just treating the symptoms, but not really trying to figure out the cause, and probably having tremendous downstream effects in terms of their long-term risk of developing a heart attack or any type of further cardiovascular events.
Well, I think this whole event and what you're doing here to raise awareness of the more global issues regarding men's health is going to be truly beneficial for providers. And I think this is one piece of that puzzle, but I think if you can start to integrate more and more, I really commend you on what you're doing.
Thank you so much, Ryan. I really appreciate it. Look forward to working with you, and thank you again. Thanks. Thank you so much. Thanks so much.
Yeah. That'd be amazing. That'd be great. So we're gonna move the cars around here a little bit. So the charging station is not working too well, and we need a lot of charge, and we're already behind. So we're gonna have to find some solution here. But this is just crazy.
about 111 miles as pro quad to the supercharger. The actual miles are 119 kilometers. So that's much better. Right off. Still should get up to that rate. And I think 9:15. Thanks so much, guys. Oh, no problem. Next shot. Yeah. Calculation for overall. Can you close the door for a second? Fred? Air concealment. I don't think they're charging anyway. I don't think it's making a difference. Still like at 86, right?
Hey guys, we actually are a little stressed out right now. The issue is we're charging.
How many miles do you have? Yeah, how many miles do you guys have on yours? Oh yeah, can you guys?
Yeah, you guys stop. You guys stop.
Charging then?
Stop charging.
Yeah,
The problem is that we are going really slow with our charging, and
Yeah, you guys don't
at
mind
this rate, it would
disconnecting, right?
take us 2 hours to charge this car, but usually it should only take a half an hour. And we're a little stressed out right now because we're already about an hour behind, and this is gonna. This is not gonna help. This is pretty serious.
I think so. Now, do we have the you have your key?
He's already. Did you take the key?
Let's just unplug it and plug it back in to see.
Yeah. That's weird. This is still.
It's not jumping up, so let's just get it to reestablish it. So.
Yours is flickering faster than theirs is.
Yeah, but it should crank up to 200. Right?
Yeah, it should. And I think it is the order. There's no doubt
There is some algorithm
Yeah,
they use.
yeah, I agree. This is going to definitely crank it up. Come on, baby. This will crank it up.
See, it says 0.
Yeah, it'll take a
It
second.
takes a few minutes, yeah.
It'll start momentarily. There's our voltage, I think.
Voltage is cranking up.
And then amperage if it needs to get into the 200s.
Exactly.
Oh, we can hear the machines now, dude. You hear them?
Yeah.
They just turned on in the back.
The voltage is still better. The voltage is doing much better.
Much better, yeah. There's definitely a big difference.
Yeah, and that's the key. Is the combination of voltage and amperage.
Oh, look at it just going up.
Per hour. Yeah, so
It's made a difference now, yeah. So thank you so much, guys.
So, Sidro, that's what we should do at every stop from now on. If everyone's charging, make them stop, you plug in, and then everyone...
Oh, yeah, absolutely.
So we should always be the first.
Yeah. Well, when we come, we'll just have every reset.
And actually, part of that's exactly. That's exactly right.
There is like a hierarchical.
Yeah.
Yeah, much better.
So,
Yeah.
so what was happening was, you know,